Whilst out on patrol, frontline wildlife officers must look after themselves and their fellow officers in order to stay safe. For the most part, ensuring safety involves being alert for physical dangers in the form of wildlife, people, the weather, or elements of the landscape. As with any aspect of law enforcement, your priority is to ensure the safety of yourself and your team. Before approaching any suspected crime scene, you should first stop and assess the scene using all your senses. Stop, look, and listen for any signs of potential danger, and communicate these with your team. Many threats, such as the suspects remaining on or near the scene or the presence of dangerous wildlife, are visible. However, the risk posed by disease and poisoning is a very real but invisible danger with the potential to cause lifelong difficulties or even death. We all understand the problems diseases cause and understand that some are mild, such as a cold, and others are much more serious, such as COVID-19 or Ebola. No matter how serious a disease is, we all know that we don't want to be infected by any of them. Diseases can be contracted in a multitude of ways. These can be divided into 4 broad categories. Vector-borne diseases are those that are carried by something. For example, malaria is carried by a mosquito. Fecal-oral diseases are those that arise from poor sanitation and enter the human body via the mouth. For example, cholera. Airborne infections are those that are transmitted through the air, for example from sneezing or in dust. Examples may include flu, TB, or COVID-19. Contact infections are those that are transmitted through direct contact with another person or mixing of bodily fluids, for example Ebola or HIV/AIDS. While many diseases are transmitted between people, it is also possible for infections to pass from animals to people. This is called a zoonotic disease. Ebola and COVID-19 are both examples of diseases that were initially found in wildlife. As frontline personnel who may be in contact with wildlife, it is vital you understand the risks of zoonotic diseases and protect yourselves. The most common situation for unknown zoonotic diseases to pass from animals to humans is when large numbers of animals are close together in captivity or when people are in close contact with dead wildlife and raw meat. Luckily, it is usually easy to know when you are in this kind of situation and take actions to protect yourself. Just like infectious diseases, poisons can also be transmitted through direct contact, through the air, or through ingestion, and similar precautions can be taken to avoid poison exposure as are used to avoid infectious disease exposure. You should be aware that in many cases an extremely small amount of poison can kill a person. As frontline officers, you will need to be able to identify situations when poison is a legitimate risk. Generally, if you find dead animals, unless you can find a clear and obvious cause of death such as a snare or bullet wound, precautions against the risk posed by both poisons and infectious disease should be taken. Simple precautions can save the lives of yourself and your team. Since we know the way diseases are transmitted, we can develop practices to reduce the risk to ourselves and the people that surround us, and take added precautions when we know the risks are higher, such as during a bushmeat seizure or when investigating the carcass of a dead animal. You should follow the following precautions. Whenever handling anything at a crime scene, you should wear disposable gloves. You can wear 2 pairs of gloves, one on top of the other, as an added precaution. It may be sensible to wear disposable gloves even if you are not intending to handle things as a precaution. Do not reuse these gloves. Never touch your face or hands at a crime scene, even when wearing gloves. If there are dead animals, animal parts, or fecal matter at a crime scene, wear a face mask over your mouth and nose. A cloth can be used if you do not have a purpose-made face mask. Never eat, drink, or smoke at a suspected crime scene. If you need to eat while still working on the scene, first leave the crime scene and wash your hands thoroughly. After working on a crime scene, where there is a risk of disease or pathogens, be sure to wash yourself as well as your clothes, including cleaning your shoes. At any crime scene, there is a high level of potential risk coming from a range of possible sources. While we have mainly focused on the hidden risks posed by infectious disease and poisons, you should ensure you are vigilant for all forms of possible danger. Staying safe is your most important duty at any suspected crime scene.